My name is Dr. Anders Lindberg, and I have been in the implant industry for 30 years. My last project was sold to AstraTech, a big pharmaceutical company here in Sweden. Today we are 7 members of the crew in this company, and we are developing a metal sintered EBM sintered bridge with a perfect fit on implants. And I would like to explain the ways we are doing it. So if you follow me into our scanning machine, this could be a start. What we are going to do is to scan in the model that has been created from the dental technician. When we have scanned in the model, we scan in the tooth setup that is creating the patient's, how the patient's going to look like. And after this tooth scan has been made, the computer can develop the metal framework to the sintering machine. So if you please follow me, I'll show you. We take it from the beginning. This is a model of the patient, and this patient I have put in 3 implants. Now the patient is wondering, how is it going to look like? And the dental technician makes a setup of teeth. And here we have an example of how a teeth setup could look like. Now I can show you show the patient, I can try it in, and the patient can see if it works, if the color is right, and so on. From this point, we put it into the scanner, and we scan both the model and the tooth setup. After this scan has been done, we take away the setup and scan the model. From this point, we can the computer can figure out how the metal framework and the porcelain will look like. And then we go down to the sintering machine and show how that works. And out of the sintering machine, we get about 40 full arch bridges during a night's running of the machine. They are all individual, of course. They have one file describing each bridge. So during a time of 12 hours, we can produce about 40 full arch bridges. But the problem with this sintering machine, it's fast, which means that the connecting surfaces to the implants are not good enough for directly connecting the metal framework. So what we have to do is that we have to precise the connecting surfaces of the metal framework. Okay? After precising, which has to be done in a computer because of on the European market, there are more than 2,200 different implants on the market, which means that if we have to use pre-fabricated parts, we have to have an enormous setup of small parts. So instead we have all the drawings of these platforms in our computers, which means that we, after the sintering, we precise in a milling machine. And here you can see how this bridge fits on a Cresco implants with a perfect fit. And the perfect fitting bridge that are screwed directly onto the implants. No abutment necessary. And that means that we can make a system abutment free, which means that we save money for the customers, we save money for the dental technician. Few parts, and all is in the technology of the producing of the bridge. Och det är jävligt bra. De här är ju... Oh yeah.
Öppna dörren, ja.
Nu är det genom tillbaka. Hur var det med storlek? Kan vi kolla då? Ja, kolla. Ja, jag har en grej som... Det är större som sitter här och att öppna ovanpå. Och så de sitter med ett större. Ja, men... Now we are in the scanning room, and I'm sitting here with a model of a upper jaw and a bridge that we are going to scan in. So this is a scanner. You see, it's a 5-axis scanner, which means that you have a good view of 70% of the bridge before you turn it over 180 degrees. And you get the other picture from the lower side of the bridge, and both upside and downside of the bridge. And now Mr. Persson puts put the bridge into the CAD program, and the program will slice the bridge into a 20, 40, 50 slices. And then these files go down to the sintering machine.
It looks like this.